This is Giuseppe Biondi Zoccai, and I'm glad to provide my contribution to the third scientific summit on tobacco harm reduction, focused on novel products, research, and policy. So my talk will be focusing on novel smoking products and cardiovascular risk. This is my disclosure. So smoking in general, traditional combustion smoking, has many cardiovascular effects, which are in part due to nicotine, but also are due to particulate matter and other toxics, which may impact unfavorably on cardiovascular function and cause acutely and also at long term cardiovascular disease, for instance, carbon monoxide or agents with pro-atherosclerotic effects. A key aspect of cardiovascular effects of smoking is endothelial dysfunction and damage and ensuing risk of atherothrombosis, but also increase in heart rate and oxygen consumption and decreased oxygen transport are impactful. We know that cessation is key to maximize health of our patients, reduce morbidity and mortality due to smoking, but cessation is challenging, and so recently modified risk products of tobacco or reduced risk products have been introduced, and they may be viewed as a lesser evil than traditional combustion smoking. Indeed, a modified risk product is a tobacco or tobacco-like product which can modify, hopefully reduce, the global burden of disease associated with smoking. An MRP claim is a complex one and not synonym with the reduced risk product claim. And typical modified risk products are electronic vaping cigarettes such as Juul or Blue or others, and heat-not-burn cigarettes such as IQOS or Glo. For instance, this is an electronic vaping cigarette which can be used with customized or standard liquids, and the key mechanism is heating, not combustion, up to 250 degrees Celsius of a nicotine-filled liquid, but other substances can be added, even cannabis. Whereas a heat-not-burn cigarette heats without thoroughly burning processed tobacco leaves up to 350 degrees, and so it diffuses a vapor which is a little bit more similar to the vapor, to the aerosol released by actually burning a cigarette. What about cardiovascular effects? We know that unfortunately these modified risk products, including heat-not-burn cigarettes, may cause endothelial dysfunction, less than traditional combustion cigarettes, but still in a meaningful fashion. And this is a recent work focusing on IQOS, standard cigarettes, and neutral aerosol. We also know that the cardiovascular safety of electronic vaping cigarettes is questioned, and most likely due to either nicotine or other contaminants. There have been reports of an increased risk of myocardial infarction and other cardiovascular detrimental consequences in users of these products. We have worked thoroughly and forcefully on the topic of MRPs in Sapienza University of Rome through a complex program of research projects we called VAPES, Vascular Assessment of Pro-Atherosclerotic Effects of Smoking. Basically, our first study, the SUR-VAPES 1, focused on EVC versus normal cigarettes, traditional combustion cigarettes, focusing on oxidative stress, endothelial dysfunction, for instance, appraised with the flow-mediated dilation, and we found indeed that EVC, in this case was a blue cigarette, were causing endothelial dysfunction and oxidative stress, albeit to a lesser extent than traditional combustion cigarettes. And also this was seen in terms of platelet function with an increase in platelet aggregation and in platelet activation, but lesser in a lesser fashion with the EVC than traditional combustion cigarettes. Notably, the effect was different in smokers and non-smokers. And indeed, smoking history or other features such as use of oral contraceptives was important to impact on the results of the endothelial function assessments. We also compared in the SUR-VAPES 2 electronic vaping cigarettes, blue versus IQOS, and focused on, for instance, endothelial dysfunction, and found indeed that for some dimension of cardiovascular effects acutely, IQOS was less detrimental than endothelial than EVC, possibly due to the presence of different contaminants, less toxic contaminants possibly. And this was confirmed also by praising oxidative stress and oxidative markers such as NOx2. We also tried to profile the individual responses of patients and subjects, smokers, non-smokers, to IQOS or electronic vaping cigarettes. And basically, in this explorative study published this year, we found that we can identify different clusters of patients. And so we may conclude that some people may respond better, have less detrimental effects in terms of cardiovascular safety and effects using IQOS or blue or Glo or Juul. So we might suggest people to individualize their choice of an MRP if an MRP focused strategy is chosen for smoking cessation. We also conducted recently a study focusing on indoor pollution, identifying different, focusing on different types of MRP, Juul, Glo, IQOS, and different brands, sub-brands, sub-flavors and labels, and recognize that, for instance, Juul may be causing more release in a room of particulate matter than IQOS or Glo. And we are also working very hardly to conduct other studies. This is a study which has been financed and it's going to begin enrollment shortly as soon as the COVID situation is stabilized, focusing on the intracoronary effects of smoking in the catheterization laboratory, either a Juul or an IQOS, and praising the coronary effects of acute smoke. And also other trials like the SUR-VAPES 4, focusing on mentoring, SUR-VAPES 5, focusing on chronic effects. We also, more to the point of this presentation, try to summarize comprehensively the cardiovascular effects of modified risk products. We conducted thus an umbrella review, which is a compilation of systematic reviews and meta-analysis focusing on the same topic at large. And indeed, we found that there are some suggestions, some observational evidences that electronic vaping cigarettes and heat-not-burn cigarettes may cause oxidative stress, tachycardia, hypertension, and possibly also increase the risk of acute myocardial infarction. And these may be due in part to the effects on endothelial function, actually leading to endothelial dysfunction, arterial stiffening, and also some prothrombotic effects. And indeed, summarizing in a key table in this manuscript, which is available online by Peruzzi et al., we recognize that MRP may increase arrhythmic risk, leading to lipothermia, loss of consciousness, syncope, weakness, increased arterial stiffness, leading to ischemia, increased blood pressure with effects on atrial thrombosis, myocardial infarction, renal failure, increased heart rate with myocardial ischemia, oxidative stress with atrial thrombosis, diabetes, platelet aggregation, atrial thrombosis again, decreased cardiomyocyte function, leading to LV systolic dysfunction, decreased flow mediated dilation with insulin ischemia, decreased left anterior descending flow reserve with insulin ischemia, and decreased vasodilation with insulin risk of hypertension. Despite these potential safety issues, we think that a chronic smoker of traditional combustion cigarettes may consider an MRP strategy to go forward towards cessation and abstinence. This does not necessarily overcome or overlook other strategies, including counseling, rewarding, using bupropion, varenicline, or NRT. But an MRP first strategy using either an HNBC, so for instance Glo or IQOS, or an ABC strategy first, followed by other steps, may be successful in bringing patient to eventual cessation. For instance, I must tell the tale of a patient I'm very aware of, which is myself. I was a chronic smoker of traditional combustion cigarettes. I switched from TCC to natural burn cigarette, then switched to an electronic vaping cigarette, and eventually achieved total abstinence. And I think this is really a smart way, because it keeps the ritual and all the gestures, and so it's easier for a smoker to downscale in this way and eventually discontinue smoking. Of course, each strategy has its pros and cons. There have been issues in terms of safety with NRT, with drug therapy, and of course with MRP. Efficacy may be less with psychosocial therapy or behavioral psychotherapy. The appeal is greater for smokers towards MRPs or NRT. Prescribing is suitable for some strategies, not for others. So there are some pros and some cons in each of these alternatives towards cessation and abstinence. And of course, the key point is a safer MRP will not be as safe as abstinence, and some MRPs might be less safe than others, and so be more detrimental than abstinence, and more similar in terms of risks to non-abstinence. So the key point is to move the patient towards a lower risk, which is achieved by complete abstinence in a reasonable amount of time, as soon as possible, if it's feasible. In conclusions, smoking represents the most impactful yet actionable risk factor for cardiovascular disease and cancer. Electronic cigarettes, such as electronic vaping cigarettes, heat-not-burn cigarettes, are modified risk products of tobacco, which may improve cessation rates and persistent abstinence from traditional combustion cigarettes. Electronic cigarettes may have substantial cardiovascular adverse effects, both acutely and long-term, and their use should be considered only for smoking cessation in patients at low cardiovascular risk and with a specific time for eventual discontinuation. Many thanks. For any query, you can email me at this address.